everyone, I am Ashwin Tamhankar. I am a consultant urological cancer surgeon and robotic surgeon. Kidney Cancer Awareness Month is considered in the month of March, and that's why we are here to create some awareness on kidney cancer. Today we will talk about stage 4 kidney cancer, wherein we have potential spread which has already happened in the different body parts from a tumor coming from kidney. So one simple understanding here is it's a diagnostic delay which has happened. That's why there is a spread of a cancer which has happened. So if we want to ensure that we do not land up there, it's very important for us to get detected at an early stage. That's why important for us to be vigilant about symptoms, especially bleeding in the urine or pain in the flanks. Be emphasizing on the regular health checkups after certain age. That's why we do not land up to a very late stage. Now, if someone goes to a stage 4 kidney cancer, generally chemotherapy do not work in this situation. We need a small biopsy for confirmation. The role of surgery is little less at this point of time in an upfront setting. How do we manage these patients? Is to prove the cancer by doing a biopsy. Check the status of spread elsewhere. Typically, these tumors have affinity to go to the lymph nodes in the tummy and the chest, and then the bones or some other solid organs. Based on the performance status of the patient, fitness, we take calculations of overall understanding. There are certain scores to designate called MSKCC score or Heng's model, and based on that and the fitness and the type of tumor, we tailor the approach of every patient based on the individualistic requirements. Essentially, because these tumors are chemo insensitive, there is a role of targeted therapy and immunotherapy. These two therapies are very important. Immunotherapy is sort of a new kid on the block, but it is giving phenomenal results in this particular context because kidney tumors are considered to be one of the most immunogenic tumors. That's why immunotherapy has paved the way management of these stage 4 kidney cancers, and it has come up as a boon to these patients for increasing their survival and longevity. These days, we combine targeted and immunotherapy in the fair combination, tailor the approach to the individual strategies, and give the best possible justice for these patients. These therapies are done predominantly by the medical oncology team, and a uro-oncological surgeon works in a comprehensive manner with the team. In a stage where you have very early spread, we call it oligometastatic disease. If the response to these therapies in the beginning is good, then is a role of surgery of the removal of the kidney by debulking the tumor or by reducing the burden of the tumor into the body of the patient. The surgeries of this kind are called as cytoreductive nephrectomies or cytoreductive surgeries. So that's why I said it needs a dedicated team approach of medical oncologists, uro-oncologists, everyone coming together, good pathologists, radiologists, nuclear medicine, nuclear physicists. Everyone has to come together for giving the best justice for these tumors, and that's what we call as multidisciplinary approach or a tumor board approach. Thank you so much.